What's up, TUMNAD lectures? In this video, we are going to be looking at what we call cardiac output. If you find out this video that is helpful to you, please make sure you like the video, comment down in the comment section, and please subscribe. Let's go ahead and get started. So now in this video, we are starting off the series of this beautiful kind of the concept which we call the cardiac output. By the end of the series of lectures about what we call the cardiac output, we are going to be knowing the following. The following are going to be the objectives during the study of what we call cardiac output. We need to first understand the definition of what we call cardiac output. We shall go ahead and look at what we call the components of what we call cardiac output. We also need to look at what we call how do we calculate what we call cardiac output. We shall go ahead and look at what we call the stroke volume, heart rate in great detail, which are the main determinants of what we call the cardiac output. We shall look at what we call the determinants of what we call the stroke volume. We shall go ahead and look at what we call the factors affecting cardiac output. We shall also look at what we call the venous return. We shall also look at what we call the factors which promote venous return. And then finally, we shall look at what we call the regulation of cardiac output. And don't forget, we shall have to look at some of the technical questions which are going to be set around what we call the cardiac output. Let's go ahead now and get started. In this video, we are going to be mainly focusing on the basics of what we call the cardiac output, what everyone should know about cardiac output. We shall mainly focus on what we call the definition of what we call cardiac output. We look at the components of cardiac output and then the calculation of what we call cardiac output. That's going to be the reason of today's video. Now let's go ahead and get started. Now, when we talk about cardiac output, these are going to be two words. When you talk about the word cardiac, we are reflecting what we call the heart. And when we talk about output, we are putting something out. It has been in, but we are putting it out. And it is in the heart, but we are putting it out. Okay? So now how do we define cardiac output? How do we define cardiac? How do we define cardiac? How do we find the cardiac output? Now, cardiac output, this is the volume of the blood pumped out of the heart every minute that passes. Okay, it is the volume of the blood ejected off the heart every minute that passes. Okay, so now cardiac output is the volume of blood is the volume of blood pumped is the volume of blood pumped out of the heart per minute. Okay, per minute. What do I mean by this? That every minute which passes, we want to see that volume of the blood which can be pumped out of the heart, which is going to be what we call the cardiac output. Now, having seen the definition of what we call cardiac output, let's go ahead and see what are the components of what we call cardiac output. Okay, let's look at what we call components. What we call the components. Components of what we call cardiac output. Now there are two main components of what we call cardiac output. The first one is what we call heart rate, and then the second one is what we call the stroke volume. Okay, the first one is what we call the heart rate, and then the second one is what we call the stroke volume. Okay, the stroke volume and what we call the heart rate. Now that we have seen the components of what we call the cardiac output, let's go ahead and look what is heart rate and then what is stroke volume, because they are so much important during the study of what we call the cardiac output. Now, when we talk of what we call heart rate, heart rate. Now, what is heart rate? Now, heart rate, it is going to be heart and then rate. So it is going to be the heart and then rate, which is going to be related to what we call the time. Okay, meaning that this is going to be the number of the beats the heart can make every minute that passes. Okay, they are the number of beats per minute. Okay, so now heart rate is just means that the number of heartbeats, the number of heartbeats per minute. Okay, so now that is a simplified definition of what we call heart rate. And then when we talk of stroke volume, now stroke volume, this is the volume of blood which is ejected off the ventricles every beat that passes. The volume of the blood ejected off by the ventricles per beat. Okay, so now stroke volume is going to be the volume. Is going to be the volume of blood, the volume of blood ventricles. Okay, the volume of blood ventricles eject per beat. Okay, so now that we have seen what heart rate and stroke volume means, let's go ahead and calculate and see how we approximate what we call cardiac output. Okay, now cardiac output is going to be denoted as what we call CO. Okay, and then cardiac output, we are going to be now getting it from the product of what we call stroke volume and what we call heart rate. Okay, so now cardiac output is going to be a product of what we call heart rate and what we call stroke volume. So it's going to be what we call going to be what we call stroke volume times what we call the heart times what we call the heart rate. Okay. Now, stroke volume, we are going to be writing it in short as S as SV. And then we are going to be now writing heart rate as H as HR. Okay? Now, as we have said that the stroke volume is the volume of the blood ventricles eject every beat. On average, the ventricles can eject approximately around 70 milliliters every beat which passes. Okay, so now it means that on average you're going to be having 70 milliliters every beat. Okay, 70 milliliters every beat, and then on average heart rate, the number of the beats the heart can make in a minute, it is going to be generally around 72 beats every minute. Okay, it is going to be approximately around 72 beats every minute which passes. Okay, now when we look at what we call 70 mils per beat and then 72 beats per minute, what is going to be common on both sides? You realize it's going to be what we call the beats, and then this is also going to be what we call the beats. They are going to be cancelling out, meaning that the SI units are going to be remaining as milliliters per minute. Okay. Now, when you calculate 70 times 72, it is going to give us generally approximately around 140 mils per minute. Okay, and this one is going to be what we call our cardiac output. What does this one mean? It means that every minute which passes, we are going to be ejecting all 5,040 milliliters every minute that passes. It is such another beautiful thing. Now, if I can convert this kind of the milliliters in liters, this one is going to be generally close to around 5, is going to be what we call 5 liters. Okay, it's going to be approximately around 5 liters. Now, this one is going to be for a normal person who is at rest, who is chilling, who is eating a piece of chicken. He has no problem. This is going to be the average kind of the cardiac output. But this cardiac output can keep on changing depending on the tissue demand. For example, if someone tries to do like little bit of the exercise, the cardiac output is going to be increasing because the demand for the tissues will have increased, meaning that it does not remain constant. It increases with increase in demand of the tissues. Now, for cardiac output to increase or to decrease, it is going to be dependent on what we call stroke volume and what we call heart rate. Anything that changes heart rate and when stroke volume will automatically change what we call cardiac output. What do I mean by this? If stroke volume increases, cardiac output will increase. If heart rate increases, cardiac output will also increase. If stroke volume decreases, cardiac output will also decrease. And if heart rate decreases, cardiac output will also decrease. Okay? And of course, at the back of your mind, you need to know that cardiac output also plays a significant role in what we call the blood pressure. Blood pressure is going to be what we call cardiac output times systemic vascular resistance. What do I mean by this? We know that blood pressure is going to be what we call cardiac output times systemic vascular resistance. What does this one mean? It means that if you increase cardiac output, you're going to be increasing blood pressure. If you decrease cardiac output, you will be decreasing blood pressure. If you increase systemic vascular resistance, you will be increasing blood pressure. And if you reduce systemic vascular resistance, you also be decreasing the blood pressure. So now this means that cardiac output is going to be playing a significant role in what you call a blood pressure regulation. But now we have seen that cardiac output is going to be a product of what we call stroke volume times heart rate. It means anything that interferes with stroke volume and heart rate will significantly affect what we call cardiac output. Now, in the next video, we are going to go into the detail of what we call stroke volume and what we call heart rate. We go ahead and look what we call the determinants of stroke volume. We look at what we call what are the factors that can affect the heart rate, because all these kind of things are going to be affecting what we call the cardiac output. We said that the stroke volume is going to be approximately around 70 milliliters. We shall need to go ahead and see how do we come up with what we call 70 milliliters. Thank you very much for watching, and if you think whatever I have talked is making sense, is adding to you, benefiting, please hit the like button, comment down in the comment section, and please subscribe. We meet in the next video where we are looking at what we call heart rate and what we call stroke volume in great detail. As always, TUMNAD, until we meet next time.